Hi all, today we will be discussing about thyroid antibodies. So, among autoimmune diseases, thyroid autoimmune diseases are the commonest around the world. So, autoimmunity occurs when antibodies are produced in an individual against his or her own organs or tissues. For instance, thyroid gland. So, in the thyroid gland, we have TSH receptors, and antibodies can develop against these TSH receptors. And within the thyroid cells, we have thyroid peroxidase enzyme. So antibodies could develop against these, and we call them TPO antibodies. And in the colloid, we have thyroglobulins, and antibodies developing against these thyroglobulin are called thyroglobulin antibodies. So it's a very important topic because we know that a lot of patients have thyroid diseases, and a lot of patients do get the thyroid antibody testing done. And as practicing clinicians, we need to know when to do antibodies and how to interpret the antibody reports and what is the importance of thyroid antibodies. So why do we talk on thyroid antibodies? Because antibodies do help us in making a proper diagnosis, to decide the treatment modality, and as well as to predict the prognosis of certain diseases. And also it plays a role in predicting pregnancy-related outcomes as well. So because of these reasons, it is important to know properly about thyroid antibodies. So why do only some people develop thyroid antibodies and thyroid autoimmunity, but not all? Well, it is a multifactorial, it is due to multifactorial reasons, and causes for development of these thyroid antibodies are genetic, that is association with HLA classes, and female gender, they are more prone to develop these antibodies like in any other autoimmune disease, and also during pregnancy or thyroid or any autoimmune diseases may play around. And it is shown that high iodine content or infections has also a role in developing thyroid autoimmunity. So it's not one reason per se, several factors come into play to develop these thyroid autoantibodies as well as thyroid autoimmunity. So not all individuals who develop antibodies get diseases as well. So we have to be very cautious in interpreting these test reports. So like I said, there are three antibodies: TSH receptor antibody, TPO antibody, and thyroglobulin antibodies. So I will roughly talk on each of them to highlight the importance. So TSH receptor antibodies produced against the TSH receptor on the thyroid gland acts as a stimulant to the thyroid gland, and that will make excessive amounts of thyroid hormones, which is giving rise to the clinical condition called hyperthyroidism. And in the presence of TSH receptor antibodies, we call it Graves' disease. 80 to 95% of patients with Graves' disease have TRAB antibodies. So although I told that this antibody is stimulant to the gland, there are three types: stimulatory, inhibitory, and neutral antibodies. Depending on the concentration of each one of them, the clinical outcome will manifest. It is important to note that tissues in the eye also have TSH receptors, and antibodies acting on them can result in thyroid eye disease in Graves' disease. So the question comes, when to do and how to use TRAB antibodies in clinical practice. So the first most indication is to get a proper diagnosis, especially when the diagnosis is not clear, and in areas where multinodular goiters are very prevalent. In a patient with hyperthyroidism, we need to differentiate toxic multinodular goiter from Graves' disease. So in that case, it is important. And also in certain patients with cyclical hyperthyroidism and hypothyroidism, to identify cyclical Graves, it is important to do TRAB antibodies. And number two is predicting prognosis or likelihood of relapse and remission in Graves' disease. So TRAB antibody levels at diagnosis and by the time of carbimazole discontinuation may predict the remission or relapse rate of Graves' disease. If somebody has higher level of TSH receptor antibodies, that will indicate a less likelihood of remission and higher rate of relapse of Graves' disease. Number 3 is predicting the Graves' eye disease. So TSH receptor antibodies at diagnosis is associated with severe eye disease as well as higher clinical activity of Graves' eye disease. And we know that in smokers, Graves' orbitopathy is quite common, and that was found that smokers do have higher titers of TSH receptor antibodies. And one of the other most important use is to predict fetal or neonatal Graves' disease. TSH receptor antibodies do cross the placenta and in high titers may predict the fetal Graves' disease and neonatal Graves' disease. So we can be prepared to deal with these if we detect a high titer during the second trimester of the pregnancy. Let's move on to the other type, TPO antibodies. TPO antibodies or thyroid peroxidase antibodies are associated with autoimmune hypothyroidism. Around 90 to 100% patients with Hashimoto's thyroiditis do have TPO antibodies in their serum. And when to do and how to use TPO antibodies in clinical practice? Well, you may come across patients who are completely asymptomatic and then coming up with the TPO antibody positivity results, which was done due to some other reason. But then 8 to 30% of the healthy individuals do have TPO positivity. This may indicate that there is high likelihood of them to develop autoimmune thyroid diseases in the future, but it does not warrant any treatment at present if the patient is euthyroid. So we do recommend periodic thyroid function test monitoring to detect any developing hypothyroidism or thyroid dysfunction. And like I said before, hypothyroidism has clear association with TPO antibodies, and you can diagnose the cause of hypothyroidism as an autoimmune cause if TPO is positive. But TPO antibodies are not considered as causative, it's just an association. And the other most important group is patients who are having subclinical hypothyroidism. Positive TPO antibodies in this group may indicate likelihood of progression to overt hypothyroidism in the future, and pregnancy outcome wise, patients who are subclinically hypothyroid with TPO antibodies have an association with recurrent miscarriages, premature delivery and low birth weight. And also TPO antibodies are also supportive in diagnosis of postpartum thyroiditis. So you may appreciate there are several uses of TPO antibodies in postpartum period, during pregnancy, or in patients with subfertility, generalized overt hypothyroidism, as well as it's important to know the place of TPO antibodies in healthy individuals as well. And our last antibody category is thyroglobulin antibodies. Like in TPO antibodies, thyroglobulin antibodies are associated with autoimmune hypothyroidism. 50 to 60% of patients with Hashimoto's thyroiditis do have thyroglobulin antibodies. And there's an emerging role in being used as a tumor marker in differentiated thyroid cancer recurrence. So in patients who have differentiated thyroid cancer, even if the thyroglobulin, which is the commonest tumor marker that we use, if thyroglobulin is negative, we have seen that at some times thyroglobulin antibodies may be positive and indicate a recurrence. So it has an emerging role acting as a tumor marker. So now I've talked about TPO antibodies, thyroglobulin antibodies, and extensively about TSH receptor antibodies. When to test for thyroid antibodies? The first indication is autoimmune thyroid disease or associated diseases like autoimmune polyglandular disease or isolated Graves' orbitopathy. If you suspect any of these, you may order the relevant thyroid antibody. And also in differentiated thyroid carcinoma as a tumor marker, you may use antithyroglobulin antibodies. And in ladies with subfertility, bad obstetric history like recurrent miscarriages or preterm birth, you may order the thyroid antibodies to predict the prognosis and the outcomes. So in summary, thyroid autoimmune diseases are common, and thyroid antibodies play an important role in diagnosis, management decisions, and also prognostic implication is also there. And TSH receptor antibodies, TPO antibodies, and thyroglobulin antibodies are the commonest thyroid associated antibodies. interpretation of thyroid antibodies should be done carefully and relating to the relevant clinical contexts. Thank you.